And in addition, really, it's also important to let parents know that it's not every time your child comes to the hospital that your child needs blood tests. We can make a confident diagnosis, without having to do a blood test, and we can treat without having to do a blood test.
Hi everyone, thank you for joining us again. Today we're going to be talking about how to prevent needle phobia in kids, and we have Dr. Raphael who's going to be leading this one. So Dr. Raphael, take it away.
Okay, needle phobia in children. Well, a lot of children have phobias, like they are scared of having shots or vaccines. But unfortunately, from birth from after birth to ages 4, they still tend to have some shots like vaccines, and then if they fall sick, we also tend to request that blood should be taken from them. So it's literally something that they can't actually do away from. So we are here to try to inform our parents and our caregivers how to prevent this, to prevent the children from being scared of needles or having shots. So, well, there are a lot of methods and different ways we could try to prevent this. And one of the ways are, trying to make sure that the parents are being informed and the children are also being informed on when to get the vaccine. So if, let's say, for example, the child is to get their BCG vaccine at birth, parents are being informed already about it so that they don't have to be scared. And because once they are scared, they also scare the kids. So we try to make them relax so that the children also feel relaxed, and then other vaccines that follow. So that's one of the methods. So I don't know if
I don't think, personally for me, I don't think anybody can really be prepared to be jabbed or have their blood drawn for an investigation. For example, so I'm an adult, and I take myself to the hospital by myself, and I know I'm feeling sick. It's probably malaria or some infection or something, and somebody's still telling me in the hospital, bring your hand, I want to take blood. And I'm taking a few minutes to rethink the life choices that brought me to that hospital. Because
adults I think are the worst. He's like,
when you bring that needle in my head, I'm like, I'm not sure I'm even sick. I think I need to go home. Wait, let me come back tomorrow when I feel worse. I think I can just use some paracetamol. That could work. I'll be back tomorrow.
I sometimes things look like that from here to here, like so big.
Right. Then eventually I have to mentally work myself up to get a jab or to get the blood drawn and everything. And then if as an adult you're feeling that way, you're having that phobia, I definitely understand these children. I empathize with them, really. I don't think it's easy to just go to one building. And I've said this so many times. They've associated the building with the as soon as the parents pull over into the driveway, the children are already they start crying.
Want to go.
And that's why
start inside the car.
That's why it's so important that you want to get your children to be comfortable with the fact that they may get, pricks in the hospital, because the mere fact that they're scared of the needles may make them hide their symptoms or may make them not want to come to the hospital, which puts them at, health risks and all of that. I think one of the ways that we can also do this is to distract them. Children can very easily be distracted. Somebody is singing some, nursery rhyme somewhere. Distracting works every time.
And their favorite movie or something. Something that
Cocomelon sound.
Okay.
What's that?
What's that Cocomelon sound?
It's just a mumble jumble of sound.
There you go.
Children just love it.
Amazing. I tell parents it's a different generation. When my children were growing up, it was Disney Channel and Roly Poly Oli and all these Disney movies, Caillou and all. Now all those have been retired. I said, wow. Anyway, we're talking about grandchildren now. So Yep. So anything that is fun for them, you want
Yeah.
to.
If they don't see the needle,
Yeah.
it tends to reduce the anxiety.
Yes.
And reduce the pain.
That's true.
And
When I'm going to do like some kind anything with needles, I kind of like put the needle this way, so that way, or I keep it at the back, so that way they don't even see it, and once they are distracted, they're looking at it, boom, just do it real quick.
yeah.
And then sometimes, like I still work in children's in the US, in the children's healthcare of Atlanta. And when we have children coming in and they're supposed to get needles, especially if they're coming for their second Rocephin shot, which is quite painful, we actually put Annie cream there. We order it as soon as they walk in. They have that EMLA, it's kind of like EMLA, or it's a numbing cream. You put it on, if they're getting on their thighs, on their arm, and that takes away the pain. So when you do that and they get their shot, they're like, oh, I didn't have any pain, if they're old enough. But if they're young, the goal is to minimize pain as much as possible. So if we can do that, that takes time, 20 minutes. A lot of parents just want to come in, boom, and get the shot and go. So if the child is able to get that, fine. But if they're not, then these are measures that people can do that doesn't include having medication put on the skin. Yeah.
And also, I think having to use the parents to demonstrate to them, probably like being like, oh, see daddy, see mommy is also getting her own shots. It tends to give them that sense of calmness, because as they're seeing the needle is going through them, they're like, okay, mommy is getting it, so let me get relaxed and get it as well. Then also other methods are like showing them books that showing them children that are being vaccinated, or showing a video of how a child is being vaccinated. So if they see that, oh, this child is actually calm, in the video, they tend to also try to, because children copy what they see. So when they are seeing that calmness, they try as much as possible. It's not easy, but then these are one of the ways to try to prevent the phobias from from them getting.
Parents as well, try, communication is key. Don't lie to your kids. Don't tell them they're not going to get a jab when in truth they're going to get a jab. They may get a jab in the hospital, So it's better to keep things honest and keep things open.
Yes, that's true.
Sometimes we tell the child, don't worry, when you get this jab, you're going to get a princess sticker or a Super Spider-Man sticker. That helps because they know that there's a reward at the end of the day. And what I know when, in general, when adults get their vaccines, we tell them just to relax. So when a child is relaxed and not tense, that helps to minimize the pain. And there's all kinds of pain relieving techniques that people are doing now, that nurses are being taught, official techniques that is supposed to help to ease the pain for the child, positioning of the child, the rapidity of the shot, when you go boom, as opposed to in, out, that's taking too much. Your shot shouldn't take more than 2 or 3 seconds. You should be in there, remove, kind of, how do you say it? Try and withdraw to make sure you're not in an artery or a blood vessel, and quickly do your vaccine very, very quickly. The quicker it is, the less painful it is. So that's another thing.
How about the size of the needle?
Size of needle definitely helps. If you have a smaller needle, you're fine, And I was talking about how I went to get blood draws, and the person who was taking my blood used an insulin syringe. Those are the tiniest needles. Those needles look like hair. They're so tiny. Used an insulin syringe to bubble up the area where they were going to take my blood from. By the time they put the big needle that was this big, and to my head it was like big, I didn't feel a thing because they had numbed that vein, and it was here. It just bubbled up like a little pimple. Some lidocaine, 1% lidocaine, and then and everybody should do that if they can. And I was so grateful because usually I'm like, I'm the one that is screaming and trying to run away, because when I was growing up, I grew up in Ibadan. They would take us for Novalgene injection, and that thing of, oh, when you go to a doctor's place, you must get an injection. It's ingrained in our people. So even parents, when they go to the hospital, they say, oh, I got a shot and I want my child to get that shot. I say, Mom, your child might not need that shot. So I think it's that ingrained thing. In India, apparently, they do the same thing. A lot of people feel that if they don't get a shot, that medicine you're giving them by mouth is not going to work. So they want the injections, and it's not necessary. Some medicines work much quicker if you even do it oral, especially if the child is not vomiting or having diarrhea. If they're having vomiting or diarrhea, give them some Zofran or Dancetron, then give them the medicine orally. They don't have to get a shot unless they absolutely need it. But when you're getting vaccines, then that's also like kind of wet and water. You have to give it and you just give them a prize at the end of the day for being brave, and they'll be happy to come back because they'll remember the prize or the popsicle or the sticker more than the shot.
Children
Kind of
forgive
like-
so easily.
Yeah.
They forgive so easily.
Yeah.
And I think it's important to also try to bring your child to the hospital when your child is not ill.
Yes.
When you know that there's very little chance that your child is going to be getting a jab or a prick or a blood test. Basically for a checkup. Those basically well visits, can get to familiarize a child with the hospital environment and try to remove the phobia from them as well.
Especially after the 4 to 5 year old shots, you don't get any more shots until you're 11 years old, unless you're going abroad and you need a flu shot, which is every year. But if you're not abroad and you're in Nigeria, we don't do flu shots routinely. So it's always nice to come to the doctor's office and you don't need blood work or anything. Yeah, that's a good idea. Yeah. Okay, so do we have any last words, Dr.?
I mean, in general, it's very important to, I think, definitely, if they are older children, not lie to them. Let them just experience the doctor's visit as it should be. If they need a jab, they will probably have to get one. But again, sometimes it could just be the little pinch just to get the blood.
The blood,
And
finger
then
stick,
the
yeah.
finger stick, exactly. And I think if there is no need to give a jab for anything, we just go with the oral medication and then they go home. So I think that boosts their confidence. They come some other time and they're happy.
Yeah.
And in addition, really, it's also important to let parents know that it's not every time your child comes to the hospital that your child needs blood tests.
Yes.
We can make a confident diagnosis, without having to do a blood test, and we can treat without having to do a blood test.
Yeah.
So
that's a psychological thing too.
Yes.
Because people are used to going to the doctor and every time blood test, but it's not necessary. In the US, if I see 20 or 30 patients, maybe only like 5 or 6 need blood work. The remaining 25, they don't. And it still doesn't compromise care because I'm not checking blood for that child. The child might not need it. It's not every time you go to the hospital that you need a blood test. Now, if the child has a fever and you want to check for malaria or you want to check a white count to see if there's a bacteremia, then that's different. But if your child is going in for a rash or a cold without a fever, you don't need. And that's why, it's good to go to a place where standard good medicine is practiced. And that's why we use the guidelines from the American Academy of Pediatrics. So that way you're not doing things anyhow. We have a guideline, a standard that we use. And at the end of the day, the child, any child that comes in gets standard of care. All right.
Yes.
One last word, 1 minute.
Yes. And I also think parents should stop using, needle pricks to scare their kids, because when the actual, needle prick comes now, they are actually being scared because of how we always keep using it. So
like a threat.
it becomes very difficult for all the doctors or the nurses to even, try to calm them down. And also, please, parents, do help us, if you're calm, your kids will be calm. If you are screaming and, because I've had an experience where I was trying to collect, blood samples from the child and the mom was already crying. So if mom is crying, what would you expect the child to do? The child will definitely cry. So please, let's all be calm. And just as my colleagues all said, if a needle prick is needed, it will be done. And if it's not needed, it won't be done.
All right. Thank you very much, docs. And thank you for, please subscribe to our channel and you'll see all the social media handles at the bottom of the screen. And thank you for sharing your time with us today and see you next time. Bye-bye.